Many people think plastic surgery to be too expensive, so they avoid getting a procedure that can truly improve their lives. But according to Dr. Justin Johnson, there are times when insurance will cover the cost, and you specialize in eyelid lifts and surgery. So when does insurance step in and help foot the bill for that procedure?
When their vision is affected by the eyelid tissue. So if you have a certain amount of visual field loss or the tissue's touching your eyelashes, they'll cover it most of the time.
And in terms of benefits of this procedure, I mean, for a lot of people, it does become a visual impairment.
It does. You know, it affects how they drive, how they read. They'll bump into things. People tell them they look angry. You know, it's especially prominent if they're like trying to get a job. Sometimes it'll even affect their ability to get a job because they'll look like they're tired or not awake very well.
You recently worked with one patient whose life was really changed by this procedure, you say?
Yeah, we had this gentleman, Mr. Tapia, 7-year-old gentleman you see here, and he had just moved from California, been here a little less than a year, and he was bumping into things, hitting his head, and he went to get his driver's license photo, and he had a struggle with the exam. You know, and he has 3 kids that he moved to see here and 6 grandkids and his wife, and so they're like, you know, you really should get this looked at. And the other thing, he has diabetes, so he's having some eyesight problems anyway, so he went to see his eye doctor, Dr. Davis, and Dr. Davis sent him over to see me, and, you know, we got him insured through, he actually has Medicare, so Medicare took care of the procedure. It covered everything, and so we did an eyelid lift and an eyebrow lift, and he's seeing, you know, significantly better. Really enjoys his surgery. You can see here after how much nicer that looks. His eyebrows are up nice and high. His eyelids are up nice and high. Not bumping into things, not hitting his head. Was able to get his, you know, pass the exam for the driver's license. Able to go camping with the kids. In fact, his wife ended up getting a procedure done as well. So
really?
did both he and his wife.
Okay, all right. From what I understand, you use a special state-of-the-art technique that is actually bladeless. Is that correct?
Yeah. So I use, you know, you can use like a blade to cut. I use a laser to do all my cutting and my dissection. What the laser does is it cauterizes the blood vessels when you cut, so you come out without any bruising or swelling. And then I use a tissue sealant to close, rather than sutures, which also cause bruising and swelling. So it's a sutureless, bladeless eyelid lift.
And you're actually teaching other doctors this procedure?
Yeah, I was a professor at Duke for several years and taught this procedure there. And so there are you know, a few people out in the world who do that, mostly the fellows that I instructed who do that.
Great, great. Yeah. Well, if people have more questions, how do they find out more?
They can call us. Their number's pretty easy to remember. It's 281-FACE. That's 281-3223. Or they could go to our website, eyelidexpert.com. And just give us a call. I'm happy to take a look at them. It's a great procedure.
All right, Dr. Johnson, thanks so much for stopping in.
I appreciate it. Thanks.